So now that we've learned how to set up our Pro-Select Platinum, we are now going to be able to do a little bit of training on this to make sure that your stroke is correct and it's exactly what we need for our patient, optimal comfort, and also so that it's effective for you as a hygienist to understand the difference between this and a Cavitron. So I spoke of this little metal piece before, and I want to start here. This metal piece will help you to adapt your tactile pressure or your lateral pressure to the patient to give optimum performance for this. So using this light lateral stroke, which is about 3 to 5 grams, which is not very heavy. It's about the amount of grams that we would use to do a probing for our patients. So a nice light lateral pressure. So we'll start just by showing you here that when we are using this for our patients, we want a nice light lateral pressure, just enough to really remove, and just to show you the difference too between linear and elliptical stroke. So between going from the linear, which is I don't miss anything and it never misses the tooth, and also you can't feel this, but that's how we're also going to be able to get our tactile or our lateral pressure down for this unit. Very important that you remember, for optimal comfort for you and the patient, light lateral pressure and a light lateral movement to keep the tip activated. Use this to practice on before you actually go into the patient's mouth. If you're switching from magnetostrictive to piezoelectric, we want to make sure that our tactile sensitivity is very important. So, and our lateral pressure. So a light lateral pressure, and I'll just turn the light off there for a second, just to show you the difference on that, and then show you. So it's nice light lateral pressure. We don't want to gouge this piece of metal. All we want to do is be able to take off the layer of it. So you want to get that down. So now, just to show you the difference, I want to be able to show you when we're demonstrating this to an office, we want to make sure that we have our fulcrum finger resting on the tooth, just like they would, so that it looks like we know what we're doing and as far as what a dental hygienist does. So we want to be able to, with a light lateral stroke, very, very light, and the lighter the better. And you can see that that calculus is coming off for this for our patients, and it doesn't miss anything. So we're just going to go back and forth, light lateral strokes, light lateral pressure for this, and be able to use that technique on our patients as well. So a light lateral pressure. You will have these types of typodonts that are in your rep scalar kits as well. And they only have 2 teeth and they're in some plaster, and there's whiteout simply placed on there for the use of a demonstration. So using that nice lateral technique, having my fulcrum finger right on the tooth, so we want to have a nice light lateral pressure when we use this typodont. As you can see, they removed that quite nicely. Light lateral pressure. Just keep remembering it's a light lateral pressure to clean that tooth surface. So you want to make sure that our fulcrum finger is on here when we're practicing and being able to remove this for our patients. And because of the titanium tip, you'll notice that there's a lot less water than you'll typically see with a Cavitron. So you're not constantly following behind yourself, trying to make sure you suction out the patient's mouth. If there are any other issues that you have with the scaler or any other tips, techniques that you'd like to find out more from, certainly call us anytime or reach out to your inside sales representative or your outside sales representative. So now we want to talk about the irrigator. Now this is for billable subgingival irrigation. We want to switch this to irrigator mode simply by placing that in irrigator mode. Now during this time, it will take about 45 seconds approximately for this to heat up so that it's a nice warm soothing solution for your patients. It also will initiate healing. We would put this on chlorhexidine to do our subgingival irrigation. You can certainly use fluoride, sodium fluoride if you'd like instead. Just make sure that you suction. You remind the patient, please don't swallow while we're doing this procedure. I am going to flush some medication under your gums so that you can, we can initiate healing, and it's soothing to your tissues as well. But as the hygienist, you're going to feel that the handpiece is starting to warm up. Like I said, it takes about 45 seconds to warm up. Usually I'm talking to my patient about what I'm about to do is with subgingival irrigation. You heard that one long beep, which tells you that it's now at optimum temperature and it's ready to irrigate. So what I would do is I would simply put it into the sulcus and I would irrigate around these areas here using chlorhexidine or fluoride and just irrigate out that sulcus so that we get a nice clean pocket for healing. We can initiate the healing and also suctioning behind ourselves while we do it. A nice add-on that you can use this for as well is doing your fluoride treatments, just telling the patient make sure you don't swallow. You can also use warm fluoride to do your fluoride treatments. And that's a nice added benefit for you and your patients and for your practice as well.